Hey, I'm Dr. Wailani Sung, a veterinary behaviorist, and I'm here to talk to you about separation anxiety.
This program is brought to you by PRN Pharmacal, makers of Reconcile, fluoxetine hydrochloride. Learn more at reconcile.com.
Let me tell you a little bit about myself. I actually went to graduate school prior to veterinary school. I have my master's and doctorate in animal behavior. Then I went to veterinary school, and afterwards I practiced for several years in a general practice in Arizona. Then I moved to Seattle, Washington area and opened up my own behavior practice. After about 8 years of practice, I decided I'm going to work for a nonprofit in the San Francisco Bay Area, and I've been there for several years. Recently, I opened up my own practice in the Bay Area where I help people and pets. I see a wide variety of behavioral disorders, including separation anxiety, which is what we're going to talk about today. In the intricate world of canine emotions, few puzzles are as perplexing and emotionally charged as separation anxiety. It is a topic that hits close to home for many pet parents, leaving them feeling bewildered and helpless in the face of their furry friend's distress. Imagine the scene. You bid farewell to your furry friend only to return to her home in disarray. Shredded pillows, gnawed furniture, plaintive howls echoing through the halls. For dogs afflicted by separation anxiety, these distressing scenes are all too familiar, marking the tumultuous intersection of canine longing and human absence. Statistics paint a sobering picture. Research suggests that anywhere from 6% to 50% of pet dogs grapple with separation anxiety, underscoring the widespread impact of this often overlooked condition on canine welfare. But what lies at the heart of this canine conundrum? Gender predispositions, genetic susceptibilities, and the circumstances of a dog's acquisition, whether from a pet store or an animal shelter, all play a role in shaping their vulnerability to separation anxiety. Furthermore, certain breeds may be more prone to this affliction, adding another layer of complexity to this equation. Yet, it's not just genetics and upbringing that influences a dog's susceptibility to separation anxiety. Their daily routine and living environment also plays a crucial role. Dogs in households with single adults or multiple female adults, along with those deprived of adequate exercise during their developmental years, face an elevated risk of succumbing to the ravages of separation anxiety. Conversely, engaging in regular physical activity and obedience classes can serve as protective factors against its onset, highlighting the profound impact of lifestyle choices on canine mental well-being. But how do we recognize the subtle signs of canine distress? It is not just about shredded pillows and chewed up shoes. Those are certainly telltale indicators. Dogs grappling with separation anxiety may exhibit a range of behaviors from incessant vocalizations and house soiling to physical injuries like broken teeth or nails. It is often the more subtle signs that provide the most poignant insights into a dog's inner turmoil. Increased thirst, panting, pacing, and excessive salivation, to name a few. Recognizing and addressing these nuanced symptoms is paramount for the timely intervention and effective management of separation anxiety. By delving into the root causes and predisposing factors associated with this condition, veterinarians and pet owners can collaborate to provide the compassionate support and tailored care necessary to alleviate the suffering of dogs grappling with the profound complexities of separation anxiety. Through education, awareness, and proactive intervention, we can strive to create a world where every dog feels secure, comforted, and truly at home, even in our absence. Diagnosing separation anxiety in dogs is like solving a puzzle, with each piece revealing a new aspect of the condition. It starts with a deep dive into the dog's history, exploring their behavior patterns and triggers. Is their anxiety solely triggered by the owner's absence, or are there other factors at play? This detective work lays the foundation for a thorough assessment of the situation. As the owner prepares to leave and in their absence, Observing the dog's behavior becomes crucial. The telltale signs of separation anxiety often emerge within the first 10 to 20 minutes after a departure, a window of opportunity for keen observation. From pacing to panting, each behavior offers valuable clues to unraveling the mystery. But separation anxiety is not a one-size-fits-all condition. Dogs may exhibit a range of behaviors from anxious pacing to excessive greeting behavior upon the owner's return. It is a complex tapestry of emotions which each thread intertwined with the next. Amidst the whirlwind of canine distress, there are certain red flags that demand attention. Destructive behavior, such as chewing furniture or clawing at the doors, is a hallmark of separation anxiety. But it is essential to rule out other potential causes, such as teething or boredom, before jumping to conclusions. Vocalization is another common symptom, with dogs often expressing distress through whining, barking, or howling. Yet those cries for help must be carefully distinguished from other forms of vocalization, such as territorial barking or responding to external stimuli. In this journey to diagnose and address separation anxiety, patience and empathy are key. It is a process of trial and error, guided by a deep understanding of our canine companions' needs and emotions. By listening to their cues, observing their behavior, and seeking guidance from veterinary professionals, we can embark on a path towards healing and harmony for dogs and their devoted owners alike. Amidst the myriads of symptoms and behaviors that accompany this complex condition, it's essential to distinguish between its hallmark signs and other potential causes. House soiling, a common feature of separation anxiety, presents a prime example of this diagnostic challenge. In the realm of separation anxiety, house soiling often manifests as urination or defecation occurring soon after the owner's departure, regardless of prior elimination outside. This behavior, while distressing for both dog and owner, can serve as a crucial clue in the diagnostic process. However, it's imperative to consider a range of other factors and underlying conditions that may contribute to similar symptoms. One potential culprit is urine marking, a behavior rooted in territorial instinct rather than separation anxiety per se. By marking their territory with urine, they establish their boundaries within the environment. Cognitive dysfunction, another possible cause of house soiling, can lead to confusion, disorientation, resulting in accidents indoors. Incomplete house training or excessive confinement may also play a role in house soiling behavior. Dogs with inadequate training or limited access to outdoor elimination areas may struggle to control their bladder and bowels when they're left alone. Similarly, excitement urination, a common occurrence in young or highly excitable dogs, can lead to unintentional accidents in the home. Changes in schedule or diet, while seemingly innocuous, can also trigger house soiling in dogs. Disruptions to a dog's routine or dietary adjustments may cause stress or gastrointestinal upset, leading to accidents indoors. Additionally, underlying medical conditions such as gastrointestinal disease, urinary tract infections, UTIs, pain, or medication side effects can manifest as house soiling behavior. Arthritis, inflammatory bowel disease, IBD, food allergies, and other health issues must also be considered when evaluating cases of house soiling in dogs. These conditions can cause discomfort, pain, or gastrointestinal disturbances, all of which may contribute to inappropriate elimination behaviors. As a veterinarian, our role extends beyond mere diagnosis to encompass comprehensive care and support for both canine patients and their concerned owners. By thoroughly considering the nuances of each case and conducting thorough evaluations, we can provide targeted treatment and guidance tailored to the individual needs of each dog. In doing so, we empower the owners to better understand and address their pet's separation anxiety, fostering a harmonious bond between human and animal companions. When faced with a suspected case of separation anxiety in dogs, delving into the realm of medical diagnostics is often the first step in unraveling the underlying causes. While behavioral issues may be at the forefront of concern, it is crucial for veterinary professionals to embark on a thorough medical workup to rule out potential medical conditions that could mimic or exacerbate symptoms of separation anxiety. The journey begins with a comprehensive battery of tests designed to assess the dog's overall health and well-being. A general chemistry panel serves as a cornerstone of the diagnostic process, providing valuable insight into organ function, blood sugar levels, and electrolyte balance. By scrutinizing these key indicators, veterinarians can uncover any underlying metabolic abnormalities that may contribute to or exacerbate symptoms of separation anxiety. Accompanying the chemistry panel is a complete blood count, a CBC, offering a closer look at the dog's red and white blood cell counts, hemoglobin levels, and platelet counts. This invaluable information aids in the detection of potential blood disorders, infections, or inflammatory conditions that could impact the dog's behavior and overall health. Electrolyte levels, another crucial component of the diagnostic puzzle, are assessed to ensure proper hydration and electrolyte balance within the body. Imbalances in electrolytes such as sodium, potassium, and chloride can lead to a myriad of health issues, including neurological disturbances that may manifest as anxiety-related behaviors. Thyroxine, T4 levels are also evaluated to assess thyroid function, as thyroid imbalances can contribute to behavioral changes and mood disturbances in dogs. By examining T4 levels, veterinarians can identify any thyroid-related abnormalities that may influence the dog's demeanor and psychological well-being. A fecal exam and urinalysis round out the medical workup, providing insights into the dog's gastrointestinal and urinary health. These tests help detect the presence of parasites, bacteria, or other pathogens that could be causing gastrointestinal upset or urinary tract disturbances, both of which may contribute to symptoms of separation anxiety. Finally, a neurological exam is conducted to evaluate the dog's neurological function and identify any underlying neurological conditions that may impact behavior. By assessing reflexes, coordination, and sensory responses, veterinarians can pinpoint any neurological abnormalities that may be contributing to or exacerbating symptoms of separation anxiety. Remember, conducting a thorough medical workup is essential for veterinary professionals when evaluating suspected cases of separation anxiety in dogs. By ruling out potential medical issues and gaining a comprehensive understanding of the dog's overall health, veterinarians can provide targeted treatment and support to address the underlying causes of separation anxiety, ultimately promoting the well-being and happiness of both canine patients and their dedicated owners. With each case presenting its own unique set of challenges and variables, it's essential to assess several key factors to determine the likely trajectory of treatment and management. The prognosis for separation anxiety can be categorized into two main tiers: good and fair. In cases where the duration of clinical signs is short and the manifestations of anxiety are mild, coupled with owners who are highly motivated to engage in behavior modification exercises, the prognosis is considered good. Additionally, the utilization of psychoactive medications along with a positive response to treatment further augments the likelihood of a favorable outcome. However, in scenarios where the duration of clinical signs is relatively brief and the severity of anxiety falls within the mild to moderate range, with moderate owner compliance, the prognosis is deemed fair. Despite these challenges, the incorporation of psychoactive medications coupled with a moderate to good response to treatment offers hope for improvement and enhanced quality of life for affected dogs. Navigating the complexities of separation anxiety prognosis requires a multifaceted approach, incorporating both behavioral modification techniques and pharmacological interventions. By tailoring treatment plans to address the specific needs and circumstances of each individual case, veterinary professionals can optimize the prognosis for separation anxiety, paving the way for a brighter future for both canine patients and their devoted owners. Let's now talk about how to create a comprehensive plan. Separation anxiety in dogs requires a multifaceted approach that combines both behavioral techniques and pharmacological interventions. From environmental enrichment to behavior modification exercises, Let's embark on a journey through the myriad of strategies aimed at alleviating this distressing condition and talk about how we can train pet owners. When owners bid farewell to their furry companions, it's essential to create an environment conducive to their well-being. Environmental enrichment, including interactive toys and special treats, provides mental and physical stimulation, helping dogs associate departures with positive experiences. Additionally, establishing a consistent daily routine complete with exercise, rest time, and playtime fosters a sense of security and predictability for dogs. For owners grappling with separation anxiety in their dogs, various management strategies can offer relief, from pet sitters and dog walkers to the introduction of another pet or companion animal. Exploring alternative care arrangements can mitigate distress. Additionally, the use of white noise makers or soothing music can help mask outside noises and create a calm atmosphere for dogs in their owner's absence. Destructive behaviors and house ruling are common manifestations of separation anxiety in dogs, necessitating targeted interventions. Environmental enrichment, such as interactive toys and special treats, can redirect destructive tendencies, while enzymatic cleaners and limited access to certain areas of the house can address house ruling issues. However, punitive measures should be avoided, as they can exacerbate anxiety and worsen behavioral problems. Training and behavior modification form the cornerstone of separation anxiety treatment plans. Techniques such as counter-conditioning and desensitization aim to rewire negative associations with departure cues, replacing them with more positive responses. Gradual absence exercises coupled with vocal feedback systems allow dogs to acclimate to brief departures, gradually reducing anxiety and promoting independence. In cases where behavioral interventions alone may not suffice, pharmacological interventions can offer additional support. In medication, such as Reconcile, fluoxetine hydrochloride, when combined with behavior modification, have shown promising results in alleviating separation-related distress in dogs. Treating canine separation anxiety requires a holistic approach that addresses both the behavioral and pharmacological aspects of the condition. By tailoring treatment plans to suit individual dogs and their owners, veterinary professionals can help alleviate distress, promote well-being, and strengthen the bonds between the pets and their human companions. In addition to behavioral interventions, the use of natural supplements and psychoactive medications can play a crucial role in alleviating distress and promoting well-being. Let's explore the diverse arrays of options available to us in managing this challenging condition. Natural supplements offer a holistic approach to addressing separation anxiety in dogs. From dog-appeasing pheromones to calming ingredients such as L-theanine, L-tryptophan, and herbal extracts, these supplements aim to promote relaxation and reduce anxiety levels. Philodendron amarens and Magnolia officinalis extracts, for example, mimic the effects of conventional anxiolytic medications, providing a natural alternative for pet owners seeking gentle yet effective solutions. Selecting the appropriate psychoactive medication requires careful consideration of various factors, including the duration of action, target neurotransmitter and receptor, and desired effects. For mild anxiety cases, options such as trazodone, clonidine, and benzodiazepines may offer short-term relief, particularly if the owner's absence is brief. Supplements like L-theanine can complement these medications, especially when the dog's anxiety is limited to short periods. In cases of moderate to severe separation anxiety, a multimodal approach involving behavior modification, polypharmacy, and referral to a board-certified veterinary behaviorist may be necessary. FDA-approved medications like Reconcile, fluoxetine hydrochloride, and clomipramine serve as cornerstones of maintenance therapy, particularly when comorbidities or escalating anxiety levels are present. However, it's crucial to tailor the treatment plan to each individual patient's needs and response to therapy. Reconcile is a once-daily flavored chewable tablet that contains fluoxetine hydrochloride, a selective serotonin reuptake inhibitor, SSRI, indicated for the treatment of canine separation anxiety in conjunction with a behavior modification plan. Serotonin reuptake inhibitors work by blocking the reabsorption of serotonin, a neurotransmitter responsible for mood regulation, into nerve cells in the brain. By preventing serotonin from being taken back up too quickly, SSRIs help to increase the levels of serotonin available in the brain's synapses, which enhances communication between nerve cells and helps regulate mood and anxiety more effectively. According to a study, at the end of the 8-week study, 73% of dogs treated with Reconcile chewable tablets show significant improvement as compared to behavior modification alone, 51%. During the course of therapy, 42% of dogs showed improvement within the first week, which is significantly greater than behavior modification alone at 18%. The patient's response to therapy should be monitored. If no improvement is noted within 8 weeks, case management should be reevaluated. When managing separation anxiety, reinforcing calm, relaxed behaviors and creating a safe, happy environment for the patient are paramount. Gradual desensitization to absences, coupled with positive reinforcement techniques, can help prevent escalation of anxious behaviors. Additionally, collaboration with behavior specialists ensure comprehensive care and optimal outcomes for our patients. You can find a board-certified veterinary behaviorist at dacvb.org. That's it for separation anxiety. If you would like to learn more about separation anxiety and behavior medicine, check out my other videos on myvetcandy.com. Thank you for watching.